want a lot of fatalities. I want to erase my memory of this. Town. I want to cause a lot of miseries. I want a lot of fatalities. I want to erase my memory of this town. It's so much. So this is the plan. You're gonna infiltrate this area, spread the disease, and kill everybody here. You understand?
Kuya, what's this?
Brittany, get out.
No, you need to stop
Brittany,
this.
get out.
It's not gonna do anything good. You have to stop this. Here you go.
Brittany, get out.
You need to stop this. This is not gonna make her come back.
You don't understand.
You'll just regret this.
You don't understand.
It's not gonna do anything good.
I just have to do this. I just have to. You don't understand how it feels. I just have to do this. Brittany, I just have to do this. Now get out.
Damn, it feels good to be a gangster.
Good evening, world. Welcome to Neogens today. 2 days ago, in the local Chewy town, several people has been admitted to the prestigious CON clinic after being said to have consumed the veggie meat from the local cafeteria 10 days ago. These people has been manifesting fever and cold and cough also. These people have been experiencing different kinds of signs and symptoms. Those are fever and cough, severe abdominal pain and also diarrhea, and some even have papules and that turns into vesicle. At first, the health workers thought that it was just a normal case of food poisoning. But after they have tested several diagnostic tests, they found out that it was a case of anthrax. So to learn more about anthrax, we have invited 2 professional nurses from CON Clinic to help us understand more about what is this disease and what is anthrax. So thank you, Ms. Daphnie Abesamis and Ms. Veryl Laplana for joining with us tonight. So we are really curious about anthrax because it's been a while since we've last heard it. Can you kindly explain to us about this disease and what are the manifestations of it?
Okay, so I'll go with it. What is anthrax? For most people, they don't know it yet. And anthrax is basically an acute disease, and it is caused by a spore-forming bacterium. It is called Bacillus anthracis.
So what is the manifestation of a person having anthrax?
So basically, anthrax has different manifestations. And of course, as I've mentioned earlier, there are 3 forms of it or types of it. And we have inhalation, we have the ingestion, and we also have the cutaneous one. So that's for the part of the skin. So I will start first with inhalation. So basically, inhalation, you have it through inhaling the spores of this bacterium, and it would enter into our airways and it would cause inflammation into that. And initial symptoms of this would cause us to have a flu-like symptoms. So initially, a person with inhalation anthrax would have a cough, would have fever, malaise, and also body weakness or fatigue. And later on, that inhalation anthrax would lead to severe respiratory problems and shock. Left untreated, inhalation anthrax is usually fatal. Next one, we have cutaneous anthrax. For this one, the spore or the bacterium could enter into our skin areas, especially those areas which the skin has cuts, abrasions, or open wounds such as those. And that would of course cause infection to the skin and cause further inflammation, resulting into vesicles, a painless ulcer, and a black characteristic in the middle. So basically, if left untreated, this could also be fatal for the people who has been infected with anthrax.
So thank you, Ms. Veryl, for explaining to us the mechanism of anthrax and what are the manifestations of it. And now, Ms. Daphnie, we want to know what is the history of anthrax, because we heard that it was used as bioterrorism agent. So can you explain to us?
As we have heard from Veryl, there's a lot of manifestation, and yes, anthrax is very lethal. And when they found out, the first time they found out about it was during the First World War. The Germans was the one who used it, and the thing that they did is that they took the anthrax and infested the animal stock. That is the provisions of the military soldiers who were fighting the battle. So the animals got infected, and when they cooked it, of course, it was ingested by the military personnel, and a lot of them died. And this biological weapon is very feared back then, and a lot of them would utilize this weapon in order to just cause mass casualties. Usually they do it through ingestion, but inhalation is one thing that could really get a lot of people because they could die just several hours after the ingestion. That's the most lethal one. So yeah, lately though, I believe we have a new news regarding anthrax. It was done in a farm where a cow died, and it suddenly died. So they went and looked through it, and they found out that the cause of death is anthrax. Now we don't know where the anthrax came from, but we do know that there was an infestation, and they're doing their best to find out and at least prevent anything from happening again.
So were anyone affected or infected from the cow itself?
From the cow wasn't cooked, I believe. When the cow died, they did the autopsy just to figure out, the reason why it died. And I believe it's only one cow that was that died because of it.
So thank you very much for the information. So we want to know, how can we diagnose anthrax? And if it's already known, what are the pharmacologic interventions that can be used to be treated for the patient?
There are several ways in order to find out. We do several testing. We do nasal swab. We also do blood cultures, tissue cultures, and we even do spinal tap. We do one thing also, the polymerase chain reaction. And if they're inhaled the agent or the anthrax, we also do X-ray just to see how the lungs is doing. We cannot really identify if it's anthrax if we just use one diagnostic test. So we have to have all these things in order to confirm that anthrax was the agent that's causing the harm to the patient. In regards to pharmacological treatment, since anthrax is actually a bacteria, of course, the treatment is also antibiotic. The common drugs that we use, we have amoxicillin, ciprofloxacin, and doxycycline. And then most of the time, we support the body. If need be, if it's really severe case, we also use IV corticosteroids. But so far, yes, the main treatment is antibiotic to counter the effect of the anthrax. If need be, for example, the patient is vomiting a lot or have diarrhea, of course we also give symptomatic treatment in order to address the problem. If they're gonna have fever, we give, of course, antipyretic, then antiemetic for vomiting. We also have actually an anthrax vaccine, but since it's not really a common occurrence or event, it's given very, from time to time, so very rarely. Usually to the animals, since if the animals ingested the anthrax virus, then it could be transferred to whoever eat the meat of the animal. So yeah, we do have anthrax vaccine for the animals.
So thank you for sharing with us the pharmacological interventions. And now, as a nurse, how would you intervene in taking care of the patients? What are the nursing interventions that you will give to the patients? So thank you for your time. Thank you for joining us tonight. Now we are more aware about what anthrax is, and hopefully it will be beneficial for each and one of us. This just in, the CON Clinic has asked us to call out for Miss Lovely Pame's family or relative members because currently her condition is getting worse day by day. So if any of you who knows about Lovely Pame, the CON Clinic is asking for you to come to see her. Thank you for tuning in Neogens today. Gracia signing out.
Back, and I'm really sorry. Pame, I'm sorry. I'm sorry. Pame. You should wake up, Pame. It's too late. I shouldn't have released the anthrax. Pame, please wake up. Please. Pame. What is this? Take this out. Pame. No.
Excuse me, sir? Sir, excuse me. You shouldn't be here, sir.
Don't.
Can you please go out for a moment?
I shouldn't have released the anthrax.
Sir.
I knew you were coming back.
Sir.
Let me